Yes, sir. Go ahead. Live.
Okay. Good evening, everyone. Today I'm Dr. Dr. S.R. Mara. I'm a general physician. So today I'm going to talk about this one, novel 3 dose G protein vaccine anti-rabies. So now at first, no, uh, we have like anti-rabies vaccine that are like we are using now, like there are like 5 doses now. So people usually like
No,
they
sir.
used to. Hello.
Okay, now
Can
please
you
continue, sir.
okay,
Yeah,
can you
yes.
just I cannot forward
Sir.
it.
I'll list.
Okay, just slide
Okay, okay.
slide it. Hello. Okay.
So just give me a sir. Okay, okay, okay. Please continue, sir.
Okay. Novel 3 dose vaccine G protein vaccine. So for this is the anti-rabies vaccine. So right now we are using the 5 doses anti-rabies vaccine, that is Rabipure and other brands are there. So using this 5 vaccine, like what are the problems we are facing? So for that, this Cadel Pharmacy have come with a new idea with a new vaccine. Like this is 3 doses vaccine. It can complete within 1 week. Okay, I'm talking about this novel 3 dose G protein vaccine now. Please slide change. Okay. Rabies. Globally, 59,000 human deaths annually. It is highest in India. India had 20,000 human deaths a year from rabies, accounting for 60% of the rabies deaths in Asia and 35% globally. 91% deaths in India occurred mainly in rural areas. Slide change. Every 9 minutes, a person dies from rabies. So, what are the current management actually? Uh, Local one treatments, that is first aid at first, and then active immunization, that is vaccine, and then passive immunization, that is RIG, immunoglobulin. So now we are giving this 5 dose intramuscular regime. Actually for this we have to visit 5 visits, okay, for 5 doses. So 0 day, third day, 7th day, 14 days, and then on 20th day, like it takes like almost 1 month to complete the regime of this IM vaccine, which I'll be using now. So rabies post exposure profile PEP, actually when the dog bite, there is a wound, so we just need to wash immediately with soap and water. Okay, and then slide. What are the current challenges of PEP? So number one is non-compliance. Number two, current rabies vaccine are cell culture vaccines. And number three, inactivated vaccines are more than 50 years old technology. So, and inconsistency in potency, stability, availability, that is short supply. And then there is adverse events is there. Hello.
We can hear you, sir.
Okay. Complaint, what are the complaints? No? Complaint is like who received the full course of ARV, that is the scheduled doses of ARV on the recommended date, and delayed complaint, and then who completed the scheduled doses of anti-rabies vaccine with 60 days but deviated from the scheduled regime, and then there is dropout and non-compliant who had taken at least 1 dose of anti-rabies vaccine after animal bite but not completed all the scheduled doses. So these are the non-compliance to 5 dose. It shows that proven cause of this because like they haven't completed the full regime. Um, because of that, there are like outcome of the uh, patient. Some there are causes of death are there actually. See, it's given here. See, uh, 58 female. I'm not reading whole of it. I'm just reading the first one. Street dog, it is killed soon. Okay, and then 3 doses purified chick embryo cell vaccine, that is rabipur. No rabies anti immunoglobulin was given. So dog bite category, it was third degree. Okay, at the right of the nose, 20 days paresthesia of face, 20 days fever and restlessness, 5 days altered sensorium for 1 day. Okay, and what are the CSF findings of this? They're like total says as like 5, monomorphs is like 100%, protein 126, sugar 71, and negative staining. And diagnosis considered was rabies encephalitis. So for confirmation, they have done the confirmatory test. So rising serum and CSF virus neutralizing antibody titer of 1 is to 8,192 and 1 is to 2040 respectively after 5 days of the previous sample. And MRF findings of like bilateral brainstem mild hypersensitivity without any restricted diffusion or contrast enhancement on day 2. So treatment was given modified Milwaukee protocol from day 1, but outcome hospital survival of 16 days but died after 1 day due to lama. Out here also in the there are 2 more cases. It's the same thing. It's the lama of the same admission after because of the non-compliance to the 5 doses. The reasons of death may be due to lack of administration of rabies immunoglobulin or poor compliance to vaccination. Okay, next slide. Okay, this is the chart showing this one is blue one is compliant, and then red one is 6% is delayed compliant and 46% is non-compliant. It is in this one at Sabdarjung Hospital. It is pre-designed and 53% were non-compliant to the full course of anti-rabies vaccine. See, out of 360 animal bite patients, it was like a pre-designed, pre-tested structure questionnaire was administered by the interview technique. Okay, 53% were non-compliant to the full course of anti-rabies vaccine. Okay, next. Hello. Okay. See here also the compliance rate for intramuscular rabies vaccine was only 60%. See, on 0 day, everyone used to take on 0 day, and then third day people used to take okay some, but in 7th day like it's out of 100 there is only 85%, 85 people used to take. See, from fourth dose and fifth dose, it's very like it's becoming lesser and lesser. No, so people used to take. They don't take like it's gradually decreasing after third day. So for that, see, one of the rabies vaccine administered intramuscular on GG as hospital also mentions the compliance rate for intramuscular rabies vaccination was only 60%. Next. So this is the constraints for compliance to complete course of anti-rabies vaccine. See, Blue one, it interferes with school timing, distance of the hospital, cost incurred or forgotten dates, and loss of wages. 47%. The major constraint for compliance to anti-rabies vaccine was loss of wages. It's 47%. Okay. Next. So now this is the evolution of rabies vaccine. In 1885, it is live attenuated vaccine. So it was prepared as non-standardized dried preparation. It is usually up to 31 injections of increasing immunogenicity. Just imagine 31 injections. And they made this one on 1911. They made minimal neural content liquid preparation. The doses were like 14 doses. Each doses like 0.5 ml daily. It takes up to 14 days daily they have to take. So in for the anti-rabies vaccine, this evolution is decreasing. See, at first in 1885 it was 31 injections, and in 1911 it was only 14 injections, and in 1976, so they made again this standardized immunogenicity lyophilized, like we are using now, like Rabipure and all. So there it takes 5 doses, 5 doses only. It took only 5 doses: 0 day, third day, 7th day, 14th day, and 20th day. It's decreasing day by day, like as the years progressing. So next, non-compliance lead to evolution in treatment regime. From those 31 to 5 doses are still on. Hello. So for that, like the non-compliance is like so many non-compliance, like people are taking up to 3 doses only, and then after 3 doses there are more compliance is there, so they don't take the vaccine, they don't come and usually take. So for that we are using we are introducing a novel vaccine with simple and shortened regimen. Next. So this is novel 3-dose recombinant rabies G protein vaccine. Next. So this is first protein subunit vaccine, and it is prepared by VLP platform technology. That is, and first vaccine with 3-dose IM regimen, that is on 0 day, third day, and then 7 days. So it is better compliance due to easy to flow regimen and less visits, convenience, and it is ready to use. No reconstitution needed. Next. So what VLP technology now? So just this is the native virus. Okay. So from native virus, like G protein is difficult to stabilize. Actually, there are like 5 proteins. Okay, in rabies virus. So from that, G protein is difficult to stabilize. G protein isolation is done using VLP technology, and it is purified and stabilized by the Cadila Pharmaceuticals Limited. So virus like particles are protein complexes exist as nanoparticles. So VLPs are similar to native virus particles, but that do not contain the viral genome. They cannot replicate but can mimic the viral antigenicity without being pathogenic. So they are capable of inducing a strong humoral and cellular immune response. So where this is virus-like particles as vaccines we are using this. This is the VLP technology of this vaccine. So this is the clinical study phase. Safety and immunogenicity of a novel 3-dose recombinant nanoparticles rabies G protein vaccine administered as stimulated post-exposure immunization, a randomized, comparator-controlled, multi-center phase 3 clinical study. Okay, next. So phase 3 study is usually like to evaluate immunogenicity and safety of rabies G protein vaccine administered as a stimulated post-exposure immunization in healthy volunteers. So randomized, it is randomized, comparative control, multicentric study. Okay. So we have taken, like they have taken total subjects of 800. So on the right side, you can see there are like one is Rabipur, that is 5 doses regimen, and then on the left side there is like Travis. Okay, that is 3 doses anti-rabies vaccine. See the on this Travis, that is 3 doses regime, there are like 533 subjects they choose, and then on the right side Revipure 267 subjects out of 800 they choose, and the randomization is like 2:1. Okay, next. So what are the results? Okay, results are like efficacy is there, and then safety. See on the left side there is one graph. There is graph. See there is seroprotection on day 14 and then seroprotection on day 42. Okay, one is Rebipure and then another one is this one three Travis vaccine. So the results were consistent across different age groups and genders. Observed difference is 1.52% with the pre-specified margin of -4%. So non-inferiority for seroprotection primary endpoint day 14 and 42 were made. Okay, and then test and comparator are identical in seroprotection rate both on 14 and 42 days. So it's given for the safety. They have done this study for this one. Localized pain, redness, swelling. It's almost like it's decreased. Okay, this green one is Travis, and then that violet one is just for the reference. They take from Rabipure. Okay, see, it's very like green one for localized pain, it decrease, redness also it decrease, swelling it also decrease, and then in this systemic adverse events, like this green one is again Travis, and then that purple one or the lavender one, it's again Revipure. Okay, so see, fever it also comes down, and then this ear pain also, ear pain is maybe some other like headache also it comes down, then joint pain, nausea is not there, it's 0%. That is the study. And novel 3 dose has better safety profile as compared to the Revipure vaccine. Okay, next. Now come to the conclusion. So novel 3 dose was non-inferior to reference vaccine and less adverse effects compared to reference vaccine. Novel 3 dose was found to be safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccine. And next. So these are the awards for Cadila Parma. So Parma Innovation of the Year by the Economic Times, and then the Golden Globe Tiger Award Malaysia for Innovative Product of the Year. Thank you. That's
So,
all.
so thank you so much, sir, and to all the eminent doctors for joining us in today's webinar. As you all know that our endeavor is to spread awareness about rabies and which is fatal but can be avoided once appropriately vaccinated, as sir has already mentioned. And this was an initiative from Kerala through its innovation to serve the society and humankind. And as you all are aware that the topic of today's webinar was doses reduction, strategy in human rabies management and role of novel vaccines. And dear all the doctors, Travis is world first three-dose novel anti-rabies vaccine. With great pride, we would like to inform that Travis has successfully completed 1 year of launch, and with more than 40,000 animal bite victims being vaccinated and 100% compliance was recorded, and no case of adverse effect was registered. And with this, I would like to thank you, Dr. S.R. Marak sir, for the informative talk. We truly appreciate your efforts, sir. And last but not the least, we would like to inform, as sir has already mentioned, Travis has won two prestigious awards in innovative category, that is ET Indian Pharma Award and Golden Globe Tiger Award. And with this, sir, thank you so much for today's session, and this was very
Thank
much
you.
informative, sir. Thank you so much, sir.
Thank you.
We can leave the session, sir.
Yes, I'm leaving.
Okay. Thank you. Okay.